Good day everyone, my name is John Louis Vigaa. I am here to do a return demonstration about the assessment of female genitalia. Good morning po ma'am, my name is John Louis Vigaa, your student test for today. Um, may I know what is your name po?
Ember Hannah Nakaraan.
And how old are you na po?
18.
And when is your birthday?
September 8, 2000.
So, I'm here to do an assessment about your female genitalia, wherein I will check if there are masses, lumps surrounding your genitalia. Also, I will check if there are abnormalities or underlying conditions that are present so we can treat it immediately. Ma'am, I'm going to ask you some questions. In past few days, have you experiencing itching or pain in your genital area?
Wala naman po.
Within your past history, do you have any problems within your genital area?
Wala naman po.
Wala naman. Or any blood present in your stool po?
Wala naman.
Wala rin. Is there someone in your family had a genital cancer?
Wala naman po.
Wala. And for your lifestyle, do you smoke po ba ma'am?
Hindi po.
Okay. So, do you exercise po?
Yes po.
How often?
Twice a week.
Twice a week. So, ma'am, I'm going to tell you that this assessment will be confidential between you and me and the attending physician that I will refer you to po. Assuming that I'm closing the curtains to provide privacy to my patients. So ma'am, later po, I will assess your genital area. Is it okay with you?
Yes.
So ma'am, I will ask you to put on your gown and you can lie down. So ma'am, I will ask you to put on this gown and lay down po kayo ma'am. So as I'm inspecting, I can see that the pubic hair is well distributed and also color black and no sense of infestations po or parasites. So next naman po is your labia majora or yung pisngi po. As I can see, no signs of lesions, swelling, and excoriations. Also, symmetrical din po sila sa magkabila. And next naman po is for labia minora, spread ko lang po. As I can see po, yung clitoris, urethral meatus, and vaginal opening po, wala naman po akong nakikitang swelling, discharge, also pink, moist, and yung clitoris po natin is normal size. Ito po siya, yung sa medyo sa taas po. And also, symmetrical din po siya with labia majora. So, next naman po, I'll be palpating for the Bartholin's gland. So, as I'm palpating, there's no sign of swelling, or masakit po ba ma'am habang pinapalpate?
Hindi po.
So that's good to know po. Also, soft din po siya and non-tender. And there's no signs of discharges, which is a good sign po. Now naman po, I'll be palpating for the urethra by inserting glove finger po sa ano niya, sa vagina niya po. So before that, I will lubricate my hand. Assume that this is a real lubricant. So ma'am, I'm going to insert my index finger in your vagina. As I'm palpating, masakit po ba ma'am?
Hindi po.
So that's good to know. As I'm palpating, it is non-tender, soft, and also no signs of swelling. Now I'll be inspecting for the vaginal opening. But before that, I will moisturize my hand with warm water. So assuming that I'm already done moisturizing my hand with warm water, let's go back to the procedure. So as I'm palpating, I can feel that your vaginal opening is tight and narrow and also moist and lubricated, which is a good sign. Hindi naman po masakit, ma'am?
Hindi po.
Okay. So ma'am, pwede niyo po bang ipitin yung daliri ko? Oh, as I can see, wala rin pong drainage or mga abnormal discharges na lumabas. So no naman po, ma'am. Can you bear down po or iri po tayo? So, as I can see po, there's no signs of bulging and wala pong mga abnormal discharges na lumabas. So, thank you po. And now, I'll be inspecting your cervix with the speculum. So, assuming that this is a real vaginal speculum. So, now ma'am, I'll be inserting the vaginal speculum to your vagina. So as I can see po that your cervix is pink and in midline. Also the surface looks soft po. Now, ma'am, I'll be obtaining a specimen for the pap smear. So, done na po. And now, I'll be removing the speculum. As I observe that the color is pink and moist po, and no signs of lesions and no swelling din po, which is a good sign. And now I'm going to perform by manual examination. This time I'm going to insert my index and middle finger, but before that I will lubricate it again. So now it is lubricated, I will proceed to the examination. As I am palpating, I can feel that your cervix is firm, soft, and rounded. Also, your uterus is smooth. And now naman, I'll be performing rectovaginal examination. This time, I'm going to change my gloves and also lube it again. Assuming that I already changed my gloves and lubricate it, I will proceed to the procedure. As I am palpating, I can feel that it is smooth, movable, and firm. So, thank you po, ma'am. And then naman po, moving on for your anus and rectum po. As I can see that your anus part is free of lumps, ulcerations, and rashes. Also, there's no signs of redness din po. And the size and shape is all normal. And tinitignan ko rin po dito sa baba is for the swelling, redness, and dimpling. But as I can see, there's no signs naman po. So ma'am, maaari nyo po bang takpan ng ilong nyo? And then exhale. Then iri po tayo. So, as I can see po, that there's no signs of bulging and also no signs of abnormal discharges. So, moving on naman po tayo, I'm going to palpate for your anal. So, assuming that I already changed my gloves and lubricated. So, I'm going to insert my finger po. As I can feel that your anal sphincter relaxes and permitting my index finger to pass through, so which is a normal sign. Also, I'm palpating for the rectum. So, as I can feel po that your rectum is smooth, soft, and non-tender. Also, the peritoneal cavity is non-tender and no signs of nodules. So, I haven't seen any blood in your rectum. Also, no signs of abnormalities and irregularities, which is a good sign po. So, you can sit and dress up na po ulit. So, thank you po. And now we're done assessing your genital area. For the overall result, I haven't seen any problems within your genital area. There's no presence of lumps, redness, swelling surrounding your genital area. Also, I haven't seen any abnormalities and underlying conditions that are present. So, ma'am, I recommend you to drink your vitamins and have enough sleeps, and thank you for participating in this assessment.
Thank you.